It's Regina Lutz.
Regina Lutz. I've been a physical therapy assistant here. I started in 1990, but left for a little while when I had children and came back in 98, and I've been in the Joint Academy ever since. It opened in 2000. So it's been a pleasure seeing all kind of people come in with hurting, painful joints and go out of here and lead wonderful lives again and feel so much better than they did when they came in. So that's my reward, is to see them come back to these dinners and are feeling so much better.
Regina, what's the difference in dealing with people? You're a physical therapist, so I'm sure you've trained to do lots of different things, but what's the difference in a person that's had a joint replacement? What kind of special needs do they have?
Those people want to get to feeling better so they can get back out and do something, where your others may have had an accident. They didn't plan on doing this. These people plan. They want to get this changed so they can go on with their lives and lead a much better life than they are without the pain that they're having. So it's a lot totally different from somebody that fell and is grumbling because they don't want to get out of bed, and this person's ready to jump up the first day when we go in to see them and get back up on their feet and moving again.
Give me a scenario here. Say I've had a hip replacement. Okay, I come out of my surgery. When do I start Joint Academy?
With the Joint Academy, I have surgery on Monday. Then on Tuesday morning, bright and early, we get them up out of the bed and get them walking just a short distance. The first thing, get them up in their chair. And then after that wonderful experience, I come back behind that and do some exercises with them. And from then on, you start group therapy. You're seen twice a day for the 3 days that they're here. On Thursday afternoon, after their therapy, they get to go home and start their therapy with home health, or if they're going to an extended care unit for more rehab. One of the two things will be either home health or an extended care facility.
Is it safe to say that Joint Academy is like a jump start to the continued therapy they're going to have to do?
Yes, it is. It's a whole lot quicker jump start than we used to give. Used to make them lay in the bed for 4 or 5 days before they could get up and do anything, and now it's not 24 hours after surgery and we've got them up and moving, and it does shorten the process of getting better quicker. It's not as long, drawn out process as it used to be.
Are there certain people who are better candidates for it or does everybody who has a hip and knee?
No, they're more of your arthritic patients that have been living with rheumatoid arthritis and been in pain for a long time, and age doesn't matter. We've had as young as 17 and as old as 95, so it does not matter. There's nobody too old and nobody too young.
Regina, one of the things I've always heard from various people, from doctors in particular, is that you're never too old for joint replacement.
That's correct.
Tell me, I guess a person 75 that thinks, oh, I'm old and wore out, I just don't think I'm going to have a joint replaced, but tell them about the quality of life they'll have with the joint replacement.
Quality of life with the joint replacement. If they go ahead and get knee, hip, shoulder, whatever they have, they can start leading a better life than they probably had in their 60s or 50s because they are pain-free, and most of them have lived with this for 10 to 15 plus years because they just didn't want to give into it and have the surgery, because everybody thinks surgery, that's a bad thing, and don't want to have it. So they can just pretty much start back over and have a better retirement than they would have had if otherwise not having the surgery done. And it doesn't matter, 75, like I said, the 95-year-old, they ran rings around us because they've lived with pain for 30, 40 years, and they get right up and never say one word of pain. It's like it's instant relief to them because it's not the pain they had before their surgery.
That's the thing I hear from a lot of people, is that the pain you have after the surgery, even though you might have some pain from the surgery, is nothing in comparison to what you're dealing with before.
That's exactly right. And it's more, you have pain those first few days because of the surgery, but then it's more soreness because of us making you do things that don't really want to bend or move around, and they have to stretch muscles out when they do the surgery. So it is a lot more of soreness than the pain that they had before, because they've corrected the pain part. Now we're just strengthening and getting the soreness out.
Anything else you'd say to a person that maybe is on the borderline, like, man, maybe I ought to get it done, but
scared to or something? I would say if anything is hurting and you've been to the doctor and they say you probably should have this done, that you need to think really hard about it and get it done, because once you have it done, the old saying is, I wish I'd have done it sooner, because it is so much better than it was before, and then you're not suffering and taking all this pain medicine and you can't enjoy your family, friends, and vacations or work, whatever you may be in. So if it's hurting and they've suggested it, you need to go ahead and jump into it and not wait 5 or 6 more years down the road, because it does make it twice as hard, because you've used other muscles and not used some muscles, and things are weaker and less strength there, and it really takes a long time to get it all back.